Earlier, we had seen that uric acid, the end product of urine degradation, it's the culprit because of its very low solubility. It tends to get precipitate, and the uric acid crystal, the precipitation is the cause of gouty arthritis and uric acid nephropathy. In fact, 10% of all kidney stones consist of uric acid only. Today, we are going to see the clinical features, diagnosis, and treatment with the help of a clinical case. But just to re-emphasize one point, like anything else, either overproduction of uric acid or decreased excretion of uric acid are the causes of hyperuricemia, and persistent hyperuricemia leads to gout. One more point I would like to re-emphasize, the purines cannot be stored in the body. So therefore, whenever there is increased purine synthesis, that has to be matched by increased purine degradation, the end product of which is of course uric acid. Your patient in a drunk, inebriated state brought to hospital emergency by traffic police, bleeding from the limbs, and he was in a drowsy state. Otherwise, just a triple gout. Some very prominent people suffered from gout. For example, Newton, Darwin, and King Martin Luther, etc. But our patient was not a genius like them. In a drunk and inebriated state, he was brought to hospital emergency, and various test results, alcohol results level was elevated, so was serum lactate, and the blood glucose was paradoxically low. So that the duty doctors thought it to be a case of lactic acidosis and admitted the patient in the hospital emergency overnight. But everything changed early morning when the patient started having severe joint pain, particularly in the big toe. And that time he gave history of frequent alcohol intake and erratic eating habits also, taking very often, non-veg and fried food along with the drinks. This history, uric acid was found to be elevated. Blood sample was drawn and uric acid was found to be elevated 7.9 milligram deciliter. Actually, it is sodium urate, monosodium urate. But for the discussion, we will use these two terms interchangeably. So he was shifted to the ward for further performing for treatment and for performing further tests to authenticate the diagnosis. Synovial fluid analysis particularly was in mind. Question, state your most probable diagnosis. Pain in the big toe, lancinating, severe pain. That history, along with rise in the uric acid level above the solubility limit, that indicated towards diagnosis of gouty arthritis. But better test, this is not enough actually, because it has been, I will give you certain figures. 2 to 8% of healthy people have uric acid level above the solubility limit. 2 to 8, sorry, it is 2 to 18% people have got higher above the solubility limit, and conversely, 10% have been reported below solubility limit of 7.0 at the time of first attack. So by these figures, I'm trying to indicate that serum uric acid level is not enough, is not a definite test. For that, synovial fluid was taken and sample obtained from acutely inflamed joint and needle-shaped crystals of monosodium urate were observed. And these are very typical. They are optically bifurcated. So the diagnosis established why the condition is very painful, excruciating, lancinating. These are the adjectives sort of used for this type of pain, very typical pain. Because number one, the crystals they have accumulated in the joint space, they would cause pain. Secondly, the crystals will be phagocytosed by the macrophages. But the crystals, they destroy the lysosomes of the macrophages. The hydrolytic, strong hydrolytic enzymes, they leak out. The cell is also killed and the enzymes leak out in the surrounding joint spaces. And because of their strong hydrolytic activity, they enhance the inflammation. And that, of course, give rise to pain also. Inflammation के क्या है? Heat, swelling, redness, pain. So pain will be a prominent feature. Outline treatment of the patient. Question number 4. 24A. Number 1, the pain has to be subsided. And number 2, increase MSU or uric acid level that has to be brought down. Colchicine, it is a classical treatment for acute attack. But colchicine is not effective in other forms of arthritis. So that actually serves as a diagnostic tool also. Because if it is a case of gouty arthritis, the patient is going to respond to the colchicine. So response to treatment confirms a preliminary diagnosis. This is called X70 So colchicine fulfills the first aim, but it has got several gastrointestinal side effects. So therefore, better drugs are available now. Non-steroidal anti-inflammatory drugs, for example, Brufen and indomethacin. Second, second aim is to decrease the elevated uric acid level. उसके दो तरीके हैं. Number 1, you increase the excretion of the uric acid. For that matter, a probenecid, this drug is used. It's a uricosuric agent. It enhances elimination of uric acid via renal route. Second, inhibition of xanthine oxidase. What is xanthine oxidase? When the purines are degraded to form uric acid, xanthine oxidase, it is a key enzyme, in fact, an important enzyme during formation of uric acid. अगर इसको inhibit कर दिया तो uric acid formation will also go down. So the drug used for that is alloxanthine. It is called a suicide inhibitor. Let me explain. Xanthine to uric acid conversion is carried out by xanthine oxidase. Okay. Now xanthine oxidase acts on allopurinol also. Now allopurinol, xanthine oxidase will act on it, converting it into a compound called alloxanthine. So this product, alloxanthine, is highly reactive and effective inhibitor of the enzyme. So xanthine oxidase, it will cause inhibition of activity of, alloxanthine will cause inhibition of activity of xanthine oxidase. As a result, conversion of xanthine to uric acid will also fall down. So this method of inhibition is given a special name. It is called suicide inhibition, as it is written on top of the page. You can read the first line. It is a special type of irreversible inhibition. The inhibitor structurally resembles the substrate. What do we mean? The inhibitor structurally resembles the substrate. So allopurinol resembles xanthine. So it is converted to a reactive product, alloxanthine, and rest I have already explained. Needs re-emphasis. It converts xanthine to alloxanthine, and alloxanthine remains bound to the xanthine oxidase and acts as a competitive inhibitor. Now, another drug, febuxostat. So this I'm leaving for you people as a SDL, self-directed learning. So this is a better, more often used than allopurinol now. So diagnostic, we have seen treatment, the threefold treatment, three-pronged attack we have seen. What is effect of alcohol? You know, we had mentioned in the earlier class that alcoholic binge precipitates acute gouty arthritis. And non-vegetarian food is also taken to be a culprit. Let us see how and why. Ethanol is converted to in two-step reaction to acetyl coenzyme A. During this, there is generation of NADH. And as you know, NADH is required for conversion of pyruvate to lactate. This is by lactate dehydrogenase. तो अल्कोहल लेने के बाद लैक्टेट का और लैक्टिक एसिड का जनरेशन बढ़ जाएगा. And that explains, preliminary diagnosis of lactic acidosis because lactic acid level was elevated. Now, what this lactic acid or lactate does, it impairs renal excretion of uric acid. At the tubular level, both compete for excretion. तो लैक्टिक एसिड होगा, यूरिक एसिड का एक्सक्रीशन कम हो जाएगा. एज अ रिजल्ट यूरिक एसिड लेवल will rise. I re-emphasize, we are using the term uric acid and urate interchangeably, but they are different, of course. So that explains the finding alcoholic binge precipitate acute gouty arthritic attack. Now, what about non-vegetarian food? A lot has been said and it has been hyped. But what happens is there have been some observations which I want to share with you. When the person refrained from taking non-vegetarian food, forget about non-veg. When purine-free diet was also given, uric acid level fell only by 1 milligram per se. So that is nothing. So non-vegetarian food per se is not very bad. Why blood glucose was decreased? So iska answer, I think, we can find in this lactate in itself. Lactate is a substrate for gluconeogenesis, and it is a dead end product. It can enter gluconeogenic pathway first by getting converted to pyruvate. But when NADH is bored, the balance is shifted towards lactate. More lactate not converted to pyruvate, तो gluconeogenesis कम हो जाएगा और rather severely impair हो जाएगा after an alcoholic binge. So therefore the patient उसका blood glucose level नीचे आना शुरू हो जाएगा. And this is an important thing for you to remember after you become doctors after a few years. If patient in an intoxicated, inebriated, drunkard state comes to you, if you admit, always estimate blood glucose and start glucose dip as soon as possible. Otherwise, the patient may die of hypoglycemia. Last point, हमने अभी थोड़ी देर पहले बात की थी कि यूरिक एसिड कन्वर्जन कम हो जाएगा यूरिक एसिड xanthine और एक और कंपाउंड हाइपोजेंथिन. Hypoxanthine is first converted to xanthine by xanthine oxidase and then xanthine to uric acid by xanthine oxidase. So xanthine oxidase के inhibition से concentration of xanthine and also that of hypoxanthine will increase. Xanthine concentration and hypoxanthine concentration will increase. Now, an important observation, mixture of xanthine and hypoxanthine along with some uric acid is much more soluble compared to uric acid alone. So that is actually, that further explains why uh, this suicide inhibition drug is important. So I think that's all about the gout. We had earlier in the first class, we had seen that uric acid is problematic, उसकी solubility characteristics and causes देखे थे. In this class, we have completed by studying clinical features, diagnosis, and treatment modalities. Thank you very much.